And we're seeing, and even as we start off 2025, and we're already almost halfway through the first quarter, but we're seeing adherence be a cornerstone of so many different payer programs, whether it be payer performance network programs or like enhanced services in EQIP, for example, if people are familiar with the LAMP program, first longitudinal medication adherence, MTM programs, adherence plays into that as well. And how a pharmacy performs on those adherence metrics, whether it's adherence to statins or diabetes medications or others, this can impact a pharmacy's ability to earn those bonus payments or drive those revenue streams. And also, of course, it can tie into patient satisfaction and patient retention rates.
Welcome to the Pharmacy Quality Solutions Quality Corner Show. Buckle up and put your thinking cap on. The Quality Corner Show starts now.
Hello, Quality Corner Show listeners. Welcome to the PQS podcast, where we focus on medication use, quality improvement, and how we can utilize pharmacists to improve patient health outcomes. I'm your host, Nick Dorich. Now, today's episode, we've got a very special partner and friend of PQS and friend to community pharmacy. This is someone that I've known and worked with for a long time, and we're very excited to have her on the show today. Her name is Dr. Marci Strauss. She is a pharmacist, and her current role is Manager of Clinical Operations at Pharmacy First. Marci, welcome to the show, and how are you doing today?
Thanks, Nick, for having me. Appreciate it, and doing really well. Just trying to keep warm in the middle of January, but I really enjoy the opportunity to join you on the podcast today.
Absolutely. Yeah, excited to have you here. And like I said, know that you've been a big advocate and you're a big proponent for pharmacy, but let's hear a community pharmacy in particular, but let's hear from you. What is it that you do at Pharmacy First? What's your role and what's your background in pharmacy?
Yeah, so I'll first go into a little bit about my role here at Pharmacy First. So I've been with Pharmacy First for almost a year now, but I've spent most of my career in the independent pharmacy space. So at Pharmacy First, I currently serve as the manager of clinical operations. So I work to support our member pharmacies in implementing and expanding clinical programs to help them achieve optimal clinical and operational outcomes, and also drive those non-dispensing revenue streams. So it includes things such as providing education and training to pharmacies, help them to best utilize pharmacy performance programs and related tools such as EQIP, among others, help them identify what are those revenue opportunities outside of dispensing, who are those patient groups in most need of care, supporting them with implementing different programs into their daily workflow. So it's been a real joy to come back to the independent pharmacy space. So just prior to coming on board with Pharmacy First, I took a little break from the independent pharmacy space and worked for a international healthcare technology startup in the med management space, where they utilize AI to help improve patient outcomes through medication management. So that was a really great opportunity, but also made me realize how much I missed working with independent pharmacies. They're such a vital part of their community. And I've been in the community space, and as you alluded to, since I graduated from pharmacy school from the University of Maryland, go Terps. I started in the retail space and then pivoted over to the independent pharmacy space and worked for another PSAO for quite a while, helping to drive engagement in clinical programs, helping to build up a clinical support program to help pharmacies, and especially because there's been so many changes in the industry since we graduated and even just in the past few years. So helping those owners to really make sense of what's going on so they can thrive and keep their doors open and help their patients. And even outside of that, for me, giving back to the pharmacy community is so important. So in addition to my day job, also very active with national and state pharmacy associations. I currently serve as the immediate past president of the Maryland Pharmacists Association and chair of the board of trustees, and also held leadership roles with the American Pharmacists Association. And I would say I wouldn't be where I am today if it weren't for those around me, and mentors and colleagues and friends. So when I have that opportunity to give back, and I know this as well, is those associations, whether it's your local pharmacy association or your national association, that all kind of ties back to independent pharmacy and community pharmacy. And so trying to just stay ahead of what's going on and see how can we best support those independent pharmacy communities.
And I think that's going to be our call to action today, Marci. And when I reached out, this was, beginning of the year, and was thinking about, well, hey, how do we start our podcast? How do we start our episodes for 2025? And as you mentioned it, we're working in a different environment. Pharmacies working in a different environment. And, that really there's a need for us, for pharmacies to perhaps be aware of these changes and really kind of change how they're thinking about what they do at the pharmacy counter, how they're interacting with the patient. So that's what we want to talk about today, and going through that perspective. So I've got some high level questions that I'm going to present to you, and then you're going to help us explain, what does this mean for a pharmacy? How do we operationalize some of these activities? And ultimately, how does that benefit both the pharmacy, the staff at the pharmacy, but most importantly, the patient? So are you ready to dig in for today's episode?
I'm ready and excited. Let's go.
All right. So first off, let's start with what is a very key topic. And when we're talking about clinical services for pharmacy, the primary consideration around, clinical services, or what it is that pharmacists do, is optimizing medication regimens, but in particular, optimizing medication adherence. And this has been a big topic because there has been changes in the industry. But when it comes to clinical services and considerations for how much time and work do you need to put into optimizing and having solutions for medication adherence, how much of a focus does that play as we are here in the early stages of the 2025 year?
Mhm. That's a great lead off question, Nick. And medication adherence is something that's so important and still continue to be a main focus for community pharmacies and for all pharmacies. And as one of the most accessible and trusted healthcare providers, pharmacists can have such a big impact on patients' medication adherence. And it's really important that pharmacies continue to have solutions in place to drive adherence. And we know that non adherence can lead to a lot of negative outcomes for patients. A lot of patients across the country are still non adherent to their medications, not taking them as directed. And we know that non adherence is responsible for a lot of adverse effects, hospital readmissions, and unfortunately death annually. But also, when we think about why is it so important for pharmacies to continue to focus on driving adherence? I think as clinicians, yes, we're always aware of the impact to our patients' outcomes, and we want to help keep our patients as healthy as possible and living great lives. But also, when we think about the ROI for independent pharmacies and why it's important, we're seeing and continue to see medication adherence be a big part of payer programs and value-based contracts. And there's been significant changes in what that looks like in terms of a payer program just in the past few years with the changes in DIR fees and emergence of new programs. So for many pharmacies, it might be a different way of thinking of how they approach their adherence solutions or how they just approach different payer programs. But it's something that still requires significant attention and focus. And we're seeing, and even as we start off 2025, and we're already almost halfway through the first quarter, but we're seeing adherence be a cornerstone of so many different payer programs, whether it be payer performance network programs or like enhanced services and equip, for example, if people are familiar with the LAMP program, of course, longitudinal medication adherence. MTM programs, adherence plays into that as well. And how a pharmacy performs on those adherence metrics, whether it's adherence to statins or diabetes medications or others, this can impact a pharmacy's ability to earn those bonus payments or drive those revenue streams. And also, of course, it can tie into patient satisfaction and patient retention rates. And when we think about what are those different types of solutions? Because of course, there's so many different reasons a patient could be non-adherent, and there's different ways to approach that. But ones that I know many of our listeners are probably familiar with: MedSync, adherence packaging, medication therapy management. And I'm going to call it MTM just for a moment because that's a significant part of my background. But what we've noticed here at Pharmacy First is pharmacies that also engaged in MTM services had significant improvement in their adherence scores. So by at least 3% on average. So when we think about how much of a part adherence plays in these programs and opportunity and bonus payments, the tie into these solutions and being able to execute on these solutions, such as Sync and MTM, it really has a domino effect too. You're improving outcomes and also driving those revenue streams.
Great points, Marci. And This has often been a topic of consideration or a topic of conversation with pharmacies is, tracking adherence and, hey, why are we doing this, or why do we have to kind of show the work? And you spoke about it to some degree, why where there's a number of different solutions. The reality for a lot of us in the industry working with this is that if there was a solution that was a 100% silver bullet, we wouldn't still be here having this conversation. And I think the reality is, whether it is, medication synchronization, compliance packaging, right, or other packaging delivery, there's a number of different services or tools that pharmacies can engage with. Some of them, of course, are clinical in nature. Some of them are more administrative. But I think what we really are looking at, the health system as a whole, and then payers and us as we're having these conversations, is how do we empower, inform, and educate pharmacies to work with patients to use all of the tools at their disposal to maximize adherence in all of these cases. I think, again, going back to where I've had conversations with pharmacies, and Marci, I'm sure you've been in the same boat where, oh, I put all my patients on MedSync, they're all adherent. We know that that's not the case, for pharmacies. And it ultimately becomes, well, hey, let's make sure we have the right tool for the right job. Each and every single patient is going to be unique, and let's dig in, to work through for those patient opportunities. Now, going into our next question, Marci, let's talk about those revenue opportunities. And you talked about this a little bit already, whether it's performance network programs or enhanced services or items, but how can pharmacies maximize revenue and financial opportunities here in 2025? We're still seeing a growth of value-based contracts. Outcomes-based measures are still important. You reference, hey, DIR fees are going away, but that does not mean that the measures in consideration and optimizing performance for the measures have gone away. So, from your standpoint, and as you take a look at the industry, what does pharmacy need to consider? What do they, especially here as we're at the beginning of the year, what does a pharmacy need to consider for their operations that starts now and goes through the end of the year?
Mm-hmm. Yeah, that's a great question. And for our listeners and for any pharmacy, it really starts first with understanding your contracts, knowing what programs are out there and that your pharmacy is eligible to participate in. So if we don't know where the opportunities are or what programs we can even participate in, how are we supposed to go from there? And that's where your PSAO can really play an important role. And a lot of what I do and what we do at Pharmacy First is helping our pharmacy members really make sense of all that is going on. There's a lot of different programs out there and different structures and different metrics. And we all know our pharmacies are strapped for time. They don't have time to sit there and go through all this information. So that's where we can come in and help them with that, help them understand, hey, here are the programs. Let's say there's, 6 programs that they're eligible for. Here are the revenue opportunities. These are the program components, providing that education so they understand what's on the table, how they're being evaluated. And also then, well, what tools come into play? Okay, maybe there's a program here that's inequipped. So they need to utilize equip in this way to maximize their revenue opportunities and outcomes for that program. Okay, maybe there's another program and outcomes. Maybe there's another program somewhere else. Every program is different. So really helping them first to make sense and identify what are those opportunities. I think once you know kind of what that playing field is and what's on the table for your pharmacy, then you can start to prioritize that and put together a plan. Because it's one thing to know, okay, well, here's what's on the table, but then we have to actually implement it and execute it and sustain it to drive those results. So really work to help our pharmacies with implementation of those opportunities, starting first with making sure that they have someone in the store that can be that program champion. And it does not always have to be that pharmacist, leveraging their support staff. I've worked with hundreds of pharmacies over the years, and technicians and support staff are amazing champions for these programs. Making sure the pharmacy has access to all of the needed platforms to be able to execute on these different programs. Making sure that they complete any kind of training that they may need, whether it's more technical training on how to use a specific tool, or maybe it's more of training on a clinical area, or maybe they want to go take a course on MTM or point of care testing or something like that. But really helping them to ensure that they have that training completed, and then making sure the pharmacies are logging in regularly to identify those opportunities in these programs, because you're very familiar with this as well. New opportunities appear throughout the whole year, and then working with them to, again, integrate that into their existing workflow, setting those goals, tracking progress. And also, again, when we think about what are those best practices for success, something that I also often will recommend is the appointment-based model, trying to leverage that as much as possible. Because there's, as I alluded to earlier, there's so many different programs out there. And if we think about in the context of, oh my gosh, there's 6 programs of opportunities. How am I going to integrate this? I don't have time to add all these things. But if we try to utilize that appointment-based model and say we have a patient with opportunities for MTM, or they have an enhanced service, or they also have some opportunities in another program. Well, why don't we try and combine all that for one patient visit to the pharmacy or when we're on the phone with them? So making the most use of the pharmacy, the patient's time, the pharmacy staff time to be able to execute on those.
In a way, Marci, as you were explaining it, it kind of hit me where to some extent it's like the pharmacy needs to do their own patients will have an annual wellness visit, right? Or a comprehensive medication review where it's like, hey, this is why we're going through this to create a plan for your health for the year. Pharmacies kind of need to do the same thing at the beginning of the year to say, hey, what are these programs? How are these programs designed? Where do we need to log in? How frequently do we need to log in or check for the work? And to your point, pharmacies are busy, and they may look at some of the programs and they may prioritize. They likely will prioritize work in certain programs, and maybe not all of them, and that's okay. But the key part is that it needs to start early in the year, and then it needs to be continuous. When we talk about quality improvement in healthcare, people often reference it as just quality improvement, but I always reference this from CMS, where it really comes from its continuous quality improvement. So there's really no such thing as taking a month off or 2 months off around medication adherence, because when it comes to, especially when we're talking about a senior population, a Medicare population, a lot can happen in the span of 2 months where you may have a consultation with the patient to talk with them about their lisinopril. Well, a lot can happen in 2 months where the reason they were adherent or non-adherent 2 months ago can be drastically different when we're having a conversation in the here, now, and present. So having those gaps there certainly doesn't help the patient, and certainly can create or exacerbate some issues for your pharmacy trying to catch up on those as well. Well, Marci, I'll get to kind of our third part, and you talked a little bit about how you need to train and educate and inform pharmacy staff. And you talked, and I really loved these mentions about engaging pharmacy technicians, engaging really the kind of whole pharmacy staff. We often talk about having a quality champion for the pharmacy, but there's another aspect to this, and healthcare is about the individual, about the patient. And when it comes to these different services and follow-ups, some of these may be new conversations that patients are not used to hearing from their pharmacist, or maybe they're not used to getting a blood pressure reading or a hemoglobin A1C check at their pharmacy. So, from your standpoint, from your consideration, what are the important things, and how do pharmacy staff members appropriately communicate or prepare patients so that they can expect that, hey, yes, this is a new service at the pharmacy, but you should expect this kind of care from us going forward? What's your take on that?
It's a great question. And when we think about the patient, that's the center of all this, it really comes to shifting that mindset of the patient. For so long, when people think about the pharmacy and what services they can get at the pharmacy, okay, I'm going to go to the pharmacy, kind of like when you do your errands. Oh, I'm going to go to the pharmacy, I'm going to pick up my prescription, I'm going to go get my groceries or pick up my dry cleaning. Okay, done. And we are seeing that shift in mindset, and many people all across the country now turn to their pharmacy as their destination for immunizations. But it took us a long time to get there. And people are now seeing pharmacies as a destination for other services like point of care testing or counseling, but there's still a large perception out there, I think, among the public of pharmacies just being the place where you put the pills in the bottle, and maybe sometimes you get your flu shot, and I think that's kind of it. And with pharmacists being the most accessible healthcare provider, and patients sometimes may go into their pharmacy 3 dozen times a year. When we think about how many times they go into their provider's office, their primary care provider's office, maybe 4 times a year. That presents a huge opportunity for pharmacies to work to kind of shift that mindset of the patient, to provide that education and help the patient to understand the value add for the pharmacy. And hey, if you come to the pharmacy, the wait's going to be a lot less. You can come in and get your flu shot. Hey, we can test you for, and understanding it varies from state to state, and that's a whole nother conversation. But in general, hey, maybe we can test you for the flu or prescribe contraceptives or something like that. But help patients understand in their community what they can do. And I think you kind of, approaching it from, marketing perspective, from a patient care perspective, and it's going to take some time. And sometimes pharmacies have to get a bit creative of how they approach that. And we're still continuing to see that shift as we see expansion of pharmacist scope of practice at the state level, and we're still pushing for that at the national level. It's never been more important to help change that mindset of the patients and be able to demonstrate the value to our communities that the pharmacists can play.
Yeah, it becomes a key point. And I know speaking with many pharmacists, and whether it's people now in the day job or Marci, you and I, again, both pharmacists are maybe our colleagues or classmates that we went to pharmacy school with, that can be a part that's very uncomfortable for pharmacists because it comes off as really trying to sell, hey, this is why you got to use our service, or this is what we want to provide because this is the standard of care. It can feel a little bit uncomfortable from that part at first, but we have to be our biggest advocates. And ultimately, if we can have and create these patients as advocates for pharmacy to be able to be able to provide these services, that really becomes the ultimate winning situation. And it's really about what the patients want. If they're able to get those services, have them provided by a member of the pharmacy staff, because some of these services, hey, it could be the pharmacist. Some of these services, it could be the pharmacy technician, right, where they're providing immunizations and able to do some other aspects of care. So we have a really great opportunity to continue to maximize the opportunity of utilizing the pharmacies, the physical buildings, as a hub for patient care in the community where patients want to be able to, receive care, but really utilizing pharmacists and pharmacy technicians to the greatest of the clinical ability, but also just to the maximum of their capabilities as professionals. So, with that, Marci, I think we're kind of close to wrapping up here, and there's a lot of opportunity for pharmacy in 2025, but it is a changing world, of course, for the environments and what pharmacies are going to be doing. Before we wrap up and get into it, are there any kind of final comments, maybe thoughts that you didn't get to specifically address as we were going through the questions, or perhaps any kind of, words of wisdom or cheers that you would give for the pharmacies and for those that are listening to this podcast today?
Yeah, I would just say in these final moments of the podcast, and again, thank you to all of our listeners today. And again, when we think about just how can we start the year off strong and maximize those opportunities for our pharmacies, helping our patients, improving those outcomes, there's been so many changes just from 2024 to 2025 when we think about clinical opportunities. So for our listeners out there, I'd highly encourage you, reach out to your PSAO, reach out to the organization that you're a part of and really utilize them. And, if you're a Pharmacy First member, please reach out to us. You can find me on LinkedIn, or you can email programs@pharmacyfirst.com. But your PSAO is such a great resource and often underutilized when it comes to those clinical support services, but we can really help you make sense of all of that's happening out there so you can know what opportunities are on the table for your pharmacy, prioritizing those opportunities, and will help you make that plan and execute on that plan so you can be successful this year and really work to diversify those revenue streams. So again, I encourage you to reach out, and we're here to help as much as possible, offering consulting, offering that training, even if you just have a quick question, even if you're listening thinking that sounds great and I have no idea where to start or what opportunities my pharmacy has, that's okay. Give me a call, give us a call. That is why we're here.
Got to ask the question. That's the starting point here. Marci, final item, I think you mentioned it, but if folks do want to reach out to you, connect with you directly about some of these items, can they find you on LinkedIn? Is there a best way to contact you?
Absolutely. You can find me on LinkedIn, or you can also email programs@pharmacyfirst.com if you have any questions.
Fantastic. Well, Marci, this was a great opportunity. Again, this was me thinking about what do we do to kind of get pharmacies excited and understanding some of the changes, or just, hey, what do we need to do to make sure that 2025 is a success? This tied very well into conversations that you and I had at the NCPA conference last fall. So yet another benefit of engaging and talking with other pharmacists, really trying to make the world a better place and maximizing the opportunity for pharmacies. So Marci, thank you. Best wishes and best of luck for you and the team here as we go into 2025. And for our listeners, that does mean we have wrapped up this show for today. So we thank you for joining us. We hope you listen to the next episode of the Quality Corner Show. And before we go, we have one final message from the PQS team.
The Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.